Causes of diabetes mellitus. In the previous section, we briefly described the role that insulin plays in delivering glucose to the cells of the body. Diabetes is characterized by the cell's inability to utilize glucose for energy and the subsequent high blood concentrations of unused glucose. This inability is caused by either or both a deficiency in the production of insulin or insulin that for some reason is unrecognized by the cells. Cells cannot utilize glucose without insulin, and the insulin must be recognized by the cells in order to deliver glucose. The cause of diabetes in a specific patient is not always known. However, there are certain risk factors that can contribute to the development of this disease. Type 1 diabetes, the most common form in dogs, is caused by insufficient production of insulin. Insulin is made by specialized cells in the pancreas called beta cells. In type 1 diabetes, the pancreas produces little or no insulin. Without insulin, glucose cannot be utilized by cells as a form of energy. As a result, the glucose remains in the bloodstream, causing high blood glucose levels. Over time, it is the high blood glucose levels that can lead to the damaging health complications of diabetes. Insufficient production of insulin in the pancreas could be a result from chronic pancreatitis. Pancreatitis can be triggered by certain drugs, infection, shock or trauma, diets high in fat, and obesity. Some breeds, like Schnauzers, are predisposed to chronic pancreatitis, which makes them more likely to develop diabetes. In type 2 diabetes, the body cells are less responsive to insulin, making it difficult for cells to accept glucose as fuel. Patients with type 2 diabetes may have normal or even elevated levels of insulin, but the cells in the body reject it during the transfer of glucose. This is called insulin resistance. As a result, there is a reduction in the delivery of glucose to the cells and elevated blood levels of unutilized glucose. Cats are more likely to have type 2 diabetes related to inappropriate diets and obesity. Obesity is a common trigger of this type of diabetes. The relationship of obesity to insulin resistance is known, but the mechanism is not completely understood. It's important to realize the link between obesity and diabetes, since this is a contributing factor that we, as pet owners, can control. Obese pets are more likely to develop pancreatitis, leading to type 1 diabetes, and they are more likely to develop insulin resistance or type 2 diabetes. Appropriate diets and healthy feeding regimens can significantly reduce the pet's chance of becoming diabetic. In the next section, we will discuss the diagnosis and management of diabetes.